Well, hello, and welcome to Region 7 Zoomcasts, where we conduct interviews with our Region 7 colleagues to learn the perils and perils related to our COVID-19 response in the hopes of sharing lessons learned and learning something new that we can all benefit from. I'm Kate Bolter. I'm the nurse manager for the Region 7 Special Pathogen Treatment Centre. And today I am going to be speaking with Mike Hartley, who will share his experience of having been a participant in a COVID-19 vaccine trial. So welcome, Mike. And I was just wondering, would you mind just beginning with telling us a little bit about yourself and maybe a little bit about your work during this current pandemic?
Yes, good morning, and thanks for having me, Kate. I'm the emergency manager for UI Healthcare, which includes University of Iowa Hospitals and Clinics and Stead Family Children's Hospital. And I've been doing that for about 12 years now. And I'm also the operations manager of our special pathogen unit here at the University of Iowa. And so, very, very much involved in the COVID response. I think we took our first patient into our unit on the 10th of March. And as things have progressed throughout the state and the region, have obviously gotten busier and busier and very busy over the
Yeah.
last week or two. But I've also been fortunate to be involved in some things here on the research side. As you mentioned, I was a part of the Pfizer phase 3 vaccine trial. And we're now also participating in our statewide vaccination planning task force here for the state, as well as our own internally here. And so it's been a very interesting ride.
Yeah, it definitely has been for us as well, but really want to focus in on your experience here. So you say that you were recruited into the Pfizer study during the phase 3 part of that trial. Can you just tell us how you came to be involved in that?
Well, it's an interesting question. Me personally, as an administrative type, although I spend a lot of time on the units and working with our influenza-like illness teams and our swabbing teams and our drive-through testing and things like that, I don't do direct patient care. And so I had heard, first off, our good colleague Sonia down at Emory had been involved in the Moderna phase 1 for phase 2 trial, and I just found that incredibly inspirational when I heard that, and that she was doing that. She's a younger woman with younger children. I thought,
Right.
wow, that is a really novel and noble thing to do, and I admired her bravery, and I thought about that, and it just impressed me. And so when I heard that our institution was going to be involved in the phase 3 Pfizer trial, I got thinking about that, and I thought, myself, I'm over 60. And so knowing what we see and you see and she sees on a daily basis in terms of how this outbreak has impacted people over 60 years of age and how they're such a high risk group, that I thought, you know what, I've got kids, I've got grandkids. I've been involved with research before. I was part of my halftime of my job for a while before I got involved in emergency preparedness and biocontainment. I was in teaching and research. I was a halftime coordinator of a large research grant for trauma and cardiac arrest called the Resuscitation Outcomes Consortium. So I was always very much interested in research. So I thought, when I heard that they were taking enrollment, I thought, why not? So I filled out the online application for our College of Medicine's clinical trials group. And I thought, well, I know the Pfizer vaccine trial phase 3, they wanted people who were pretty high risk exposure to COVID-19. And I didn't think I fit that category because I'm not a bedside caregiver anymore. But I interact with a lot of the people who do. I thought, well, maybe they might pick me, maybe they might not. I don't know. I'll just throw my head in the ring. It wasn't one day. It was like 24 hours later, and I got a phone call from the clinical research team and said, "Hey, we see your application. Would you come in and be evaluated to be part of the trial?" And I was really surprised. But I said, "Sure. I mean, I'll come in, and if I meet your needs, great." But I certainly wasn't going to be disappointed if they pick somebody from the clinical teams who are, the frontline healthcare workers. That to me made more sense. But I went in anyway, and
So
lo and
what
behold,
was
they picked me.
what was the evaluation like, Mike?
Well, it was interesting. So I remember I went in for my first appointment on the 12th of August, and that was about 2 weeks after the trial enrollment had started here at Iowa. And so they said it would take about 2 hours. And so, I took a kind of an extended lunch hour that day, and I went down, and they had a research nurse come in, and it was in my building. It was only a couple floors down, so it's really convenient. So I went and sat with them, and they started having me answer questions, what I do, what kind of things I get involved with. And of course, they went in through the standard stuff, the medical history, and what your past medical history is, what medications you might be taking. They did somewhat of a clinical assessment, pretty limited, height, weight, body temperature at the time. They were very interested in, for example, in females, they wanted to make sure that you had a urine pregnancy test because they didn't want you involved in any kind of potential where you as a female candidate or a clinical participant become pregnant, or they also wanted to make sure that if you were engaged in childbearing age others, that you were not going to have any chance of reproducing. And so I said, hey, I'm over 60. Don't worry about that.
Right.
And then, if you meet all the study requirements, then they would have went ahead and drawn antibodies right there, take about 25 milliliters of blood. I was tested at that point, did a nasal swab for COVID-19. And then basically they were educating me about an online e-diary that I would be expected to fill in each day. And then they provided me with a kit that I would take home, which inside this kit, they gave me a thermometer, a digital thermometer. There was a small sort of caliper device that would measure vaccine site induration, that if I had a local exposure or a reaction with pain and swelling, that I would be able to measure and document the diameter of the induration. Showed me how to complete the e-diary. And then they also gave me a laboratory kit inside and taught me how to do self-swabbing, put the swab into a test tube, seal it up in biosafety bags. And then that would be, if I started to have symptoms at home, I was to call into the research team. They would tell me whether or not they wanted me to self-swab, package it, and then I was to call this phone number, and a courier would come that same day, some national courier, and pick up the sample, and then it would be taken in for verification and testing. And so they trained me how to do that. And then at, I'd say, probably 45 minutes to an hour later, a pharmacist showed up. And it was a research pharmacist dedicated to the research team who had the vaccine or had the placebo. I didn't know which it was. And of course, they're not going to tell you, but I know the pharmacist knew, and that was about the only person who did know. And so then I took the injection, and then basically was giving some closing instructions. And then they had me sit in a waiting room for about 15 to 20 minutes to make sure I didn't have any kind of untoward reaction from the injection. And I was off on my merry way. And then over the next 7 days, I was to take my temperature each day at the same time, and then also fill in my e-diary online on my smartphone, which was an app I downloaded. And then I was able to answer questions about symptomology or absence of symptomology, anything else that would be pertinent, and then document that for the next 7 days after the initial dose. And then they scheduled me for the next dose, which was 21 days later on September 2nd, and then basically went through the same sort of process. I was swabbed again for COVID-19. Interestingly, they did not draw blood that time after the first dose. So
Hmm.
after the second dose, they did not draw any blood at that time, but did through the clinical assessment and, went through the whole sort of review of the symptomology and things like that, looked at what I documented for the previous week and 21 days before. And then the research pharmacist showed up again with the injection of the day and received that and stuck around for another 15 or 20 minutes. And that was a much shorter visit, and out the door I went.
Wow, seems like quite an experience. I have to say, I think you're very brave, to sign up to take something that's unknown and there's no way of knowing what it was going to do to you. Did you have any reservations whatsoever?
As I sat there in the chair and, got more information, because I had it was probably the 24-page document on the consent and that sort of thing. And I'd done my own research too. I was pretty comfortable walking into it. And then as I was sitting there, I got thinking about it and I went, okay, well, this is real. But,
Yeah.
bottom line is it's phase 3. Now, I realize things certainly can go awry during a phase 3 trial, but it wasn't a phase 1, phase 2. That's why I admire our colleague from Emory so much that, I
Hmm.
don't know about a phase 1, phase 2 trial that I would have had as much interest in doing that. But I thought, by the time a phase 3 rolls around, there's probably enough data, although the N number is pretty small, that, the risks and whatnot would be acceptable. And I realized this is new technology, mRNA-based vaccination. There's never been a vaccine like that that's ever been approved for use. So I realized it was new and there are a lot of unknowns. But, the bottom line is, you know, what would you rather gamble? Would you rather gamble and my family's lives, gamble them having COVID or me having COVID? Or do you take the chance with an experimental vaccine that after I read the initial reports and reviews, it looked very promising. And so you weigh those things. And
Yeah.
the bottom line is it seemed it would be a reasonable risk and the potential benefits more so, not so much for me, but for my family and my kids and my grandkids. And, all those patients that you see in and out of your facility every day, it's like something's got to be done and you want to be part of the solution, right?
Yeah. Yeah. Well, I'm very thankful for you and other people like you that have done this. Um, one of the other things I wanted to ask about was, did you have any side effects? I mean,
Hmm.
did you have pain in your arm and or
It's a
anything
really
else?
interesting question. This is a confounder in my mind. You know, vaccinations that I've had previously in the past in my life, I've really never had any kind of localized reaction. I've taken flu vaccines and tetanus, and I mean, the usual stuff that you get. And
Hmm.
really, I don't ever recall getting any kind of localized pain, swelling, things like that, at least within recent memory. Maybe I did when I was younger. But, we get our flu vaccines here every year. I've never had any kind of localized reaction. So the first 24 hours after the first dose of the vaccine, I really didn't have any local reaction at the injection site. So there was nothing to measure in the way of an induration or swelling of any kind. But what I did notice, and this was the confounder, I was having these weird kind of minor little aches and pains in my lower back, up my shoulders, up into my neck area, and then, a little bit of myalgia perhaps. But, at my age, I'll be honest
Right.
with you, I get those kinds of things. And with the vaccine trial, I was not allowed to take any routine medications that would reduce the chance of fever or
Oh,
uh, myalgia or whatever. So ibuprofen, Tylenol, things like that, I wasn't allowed to take at least the first 7 days of after the first dose. And I do occasionally take that kind of stuff at night. Maybe a little Benadryl with it, like a Tylenol or Motrin PM. The stress of our jobs, sometimes I just need a little help to sleep. And so I wasn't able to do that. And so when these cropped up within the first 24 hours, I didn't really know. Is this from the vaccine? Which, if it is, it's pretty darn mild. Or was it something related to just the fact that I wasn't able to take anything along with it.
Mhm.
I really didn't know. And
Or
so
or just maybe that you were a little bit more conscious of how you were feeling.
maybe the other
Mm.
confounder that week, interestingly, was that's the week we had to deal with our derecho, if you'll recall. Started in
Uh,
Nebraska, swept across Iowa, etc.
mhm.
So, that week I was out cleaning up my yard with some tree debris. It wasn't horrible, it wasn't bad. And so I was thinking maybe that's why I've got these weird sort of pains and aches in my back and neck, but I didn't really exert myself that much. So it was really a confounder, Kate. I don't know whether I had any kind of reaction. And so I know, in incident command each morning, people knew that I was involved in this, and I was being asked by leadership and others, well, did you have any reaction to the vaccine? And I'm like, I don't know. I really couldn't tell them.
So having the vaccine, you still took precautions, right? You still wore a mask, still did your hand hygiene, social distancing.
Absolutely. No
Yeah.
changes. There was no change in our routine. We here in house, we wear masks and visors all the time, especially in patient care areas or whatever. So that didn't change. And I didn't do anything different at home either.
Mhm.
And just waited and completed my diary the next 7 days after the initial dose, had the second dose. And, the second dose was interesting because basically the same things occur, but I remember having to do some extra work in one of our pharmacies, in one of our pharmacy clean rooms with some disinfection technology we have, some ionized hydrogen peroxide technology. They asked me, it's used for our biocontainment unit, but they asked me to go do it in one of our pharmacy clean rooms. And I remember doing that. And it's not a lot of work or a lot of, physical activity.
Mhm.
But I remember after I got done, I was really I was sore, and I'm like, it's like I just worked out at the gym, and I'm like, wait a minute, this isn't right. Um, but again, I can't equate that specifically to the vaccine. I don't really
Yeah.
know, and that was about 24 hours after the second dose. And then other than that, no fevers, no other side effects, what they call reactogenicity. I really couldn't say that I had anything afterwards.
So if it was due to the vaccine, you would call it mild
Oh,
and
exceptionally mild.
insignificant. Yeah.
That's why it was a real question mark in my mind whether,
Mhm.
was I the placebo arm or was I in the vaccine arm? I mean, I couldn't honestly tell.
Yeah, so that's interesting that you would say that, Mike, because, and I hope you don't mind me telling the listeners this, is that you did get COVID-19.
I sure did.
Yeah.
So I don't know. I guess them picking me for the trial wasn't as sort of off out on a limb as I thought it was, and not being a direct patient care provider. I
Hmm.
actually did test positive for COVID-19. It's an interesting story. You've seen it in your facilities. We saw it in ours. Really, the majority of our staff here, as in most hospitals, don't acquire COVID-19 on the job. Sure, there's some of that, but it's a pretty small percentage. Most of us who are healthcare workers or work in a hospital, the way we become positive from COVID-19 is from community exposure. And a lot of it is really household exposure. And that's
Yeah.
exactly what happened to me. It just so happened that my wife started having signs and symptoms after a trip to see our kids and grandkids in Wisconsin. And although they were real careful and didn't go anywhere, it was all very, they're smart,
Hmm.
they did it the right way. She started having symptoms one Tuesday night. And the interesting confounder on that story was she had just had her flu shot that day. And she thought it was from the flu shot. And I said, wait a minute, you're a nurse. You work here at this hospital. You get the flu shot every year. You don't ever have any reactogenicity to flu. Why would that suddenly start? Well, a little pushback here and there. But by the next day, by the morning and afternoon on that Wednesday, she was pretty symptomatic. And I said, you know what? You better go get tested. So she did, and went through our drive up process and got the nasal swab through the window or whatnot. That Friday morning after our incident command meeting, my phone rings in my office. It's my wife. She goes, I just tested positive. I go, I knew it. And so when she started becoming symptomatic, you trained me, you
Hmm.
at Nebraska have
Oh,
trained me about what to do. So she got isolated. I confined myself to the lower level. She confined herself to the upper level. And as you've taught me in the past, I had PPE ready to go. I had the disinfectants ready to go. So that was launched at home. And I thought, okay, hopefully, if she turns positive, then exposure here is pretty minimal. We should be okay. Well, then when, of course, she tests positive, I have to let our employee health know that my spouse has turned positive. So immediately I was quarantined. I had to pack my
Mm-hmm.
bags, go home, make an appointment to get tested the next morning through our drive-up process. And so our policy here is if you've had a home or, domestic close significant contact, you're tested on day 3, on day 5, 7, and also day 10 if you're home on quarantine. And so I had my day 3 test and it came back positive. And I was surprised, to be quite honest with you, because I'm sitting here going, I feel fine. Other than maybe, I'll be honest, a little bit of extra postnasal drip, but I get fall allergy stuff anyway, so it really wasn't anything that I would have related to the disease. But sure enough, tested positive, and so I had to let the research team know
Mm-hmm.
immediately that I had tested positive. So I got a call back from the research clinician, and I received my instructions that I was to open up my kit, get out the nasal swab, test tube, biosafety bags, and things like that. Followed the instructions of swabbing myself, and then put it into the container, test tube, break everything off, seal it up, made the phone call. Courier showed up in a short period of time, picked it up, and it was sent off for verification. And so, yeah, it was an interesting experience.
Did they have you do anything different after that,
No, I
the
mean, at that
researchers?
point, now I'm isolated. And so
Mm-hmm.
my wife and I both got to be isolated for 10 days. And interestingly, I remained asymptomatic.
Mm-hmm.
Except, I will say this, about day 6 of my course, at least from the time I tested positive on a Saturday, by the following Friday, I guess it was, I noticed I'd lost my sense of taste and smell
Oh.
completely. Everything was gone. That is the only symptom I had basically throughout the whole thing. And that lasted only about 48 hours or so. By that Sunday night, I started to be able to taste things again. And, that's been almost 2 weeks ago now. And I'll be honest with you, I've got about 80, 90% of it back, but I still don't have 100% of my taste and smell. But absolutely no other residual effects at this point. And so, that begs the question. Everybody's asking me, what do you think? And I said, well, bottom line is it's one of two things. Either I'm in the placebo arm of the vaccine trial, and I basically hit the COVID symptom lottery jackpot, okay,
Right.
and I'm a very, very fortunate person who's in their early 60s.
Mm-hmm.
Or I am in the vaccine arm, and I wonder if the vaccine didn't mitigate the impact of the virus on me, and that's why I was so asymptomatic. I honestly do not know.
Will they let you know eventually?
Well, it's an interesting question. I'll find that out, I think, in about a week or so. So
Okay.
after I tested positive, um, they basically said, okay, we need to add another research visit. Normally, it's 6 visits over a 24-month period of time, and I'd already done visits 1, 2, and 3. And so
Mm-hmm.
they added an additional visit that's going to come up in the next 10 days or so, where I'll have blood drawn again, and I'll go through the usual clinical assessments and whatnot. And I intend to ask the research team at that point what the situation will be, because we had learned that if we were in the placebo arm and either the Pfizer vaccine, the Moderna vaccine, or one of them eventually gets FDA approval, then we in the placebo arm would be told that we are in the placebo arm and that we would be offered the vaccine immediately. And
Okay.
so that to me I mean, ethically that makes sense, right?
Yeah.
But now that I've tested positive, that whole dynamic changes. So those will be some of the questions I'll have for the research team. I know for a fact that if you've tested positive to COVID-19 and a vaccine is approved, They're looking at right now, and this is just from our teams here, about a 3 to 4 month period of time where you will not be eligible for the vaccine because the assumption being that antibodies are present and that there's a question on what will happen if you actually did get the vaccine on top of that. They don't know specifically, so I think the prudent thing they're thinking is that you've probably got antibody protection. You probably don't need this vaccine for at least 3 months. Maybe it's 4, maybe it's 5 or 6. They don't really know. But I know that I won't be offered the vaccine for at least 3 months, and we'll see what happens. But I'll be
Wow.
interested to see if they will then still tell me whether or not I was in the placebo arm or the vaccine arm, given that I'm positive.
That's really interesting, Mike, because as you're saying this, I'm thinking, what about the other folks who are asymptomatic and may not even know that they've gotten COVID-19? Will it be okay for them then to get the vaccine?
Yeah, and I got to think, those are questions, right? And so they'll learn
Mm-hmm.
more. Maybe they have some answers now, because my understanding, at least at the point where I became positive, which is about on the 24th of October, um, Pfizer was still waiting for the initial 32 folks within the trial globally to turn positive. They didn't have enough data yet. And so that's why things had been somewhat protracted. That's my understanding. And so, when they announced the efficacy here this week, they had actually accumulated 94 individuals who had turned positive within the vaccine trial group. Obviously, I was one of them. And
Mm-hmm.
so, interestingly, I got to think that that's one of the interim analysis data sets they're looking at is what was that person's antibody
Whoa.
level on day one, the first dose. And then, they're going to compare that, I'm sure, to anybody who turned positive subsequently after that. They should be able to correlate everything to figure out and then look at their reactogenicity to see if they had antibodies on the first day of the vaccine trial. Was the reactogenicity any different for them than it was for people who didn't have antibodies? I'm sure
All
that's
right.
part of the interim analysis, I would think.
I'm sure. I'm sure they're looking into that. Um, I do think your case is interesting, though. When the news came out that we've got this vaccine, everybody's celebrating. Hey, we've got a vaccine. Life is going to return to normal. But not quite so much. We're still going to have to take precautions. There's always going to be that percentage of people like yourself who the vaccine isn't going to protect.
Yeah, and it's interesting. People questioned me when I got back to work, and they said, "So you've had COVID? Why are you still wearing a mask?" I said,
Mm,
"Of course I'm still going to wear a mask. I'm still going to do all the things that we were doing before this because, you know, how do I know that I can't potentially pass it on to somebody else right now?" Even though
right.
I had a positive PCR test, and that was, I assume, verified by the research test that was done, without a CT value, the cycle threshold uh, detection and additional
Hmm.
testing for COVID positive that they would normally do, I wouldn't know whether I still had replication capable virus that I could transmit to someone else. And we don't do CT values on everybody. Only, that's used by EPI along with their clinical judgment to decide whether a patient who continues to test positive for an extended period of time is still infectious, can transmit. And so when the CT values indicate that they can't, then they can be taken out of isolation, even though they still may test PCR positive. But I never had that kind of test. So how do I know that I can't transmit or
Right.
pass this on to somebody else? So even after the vaccine, even after being positive, still taking precautions because of the potential to cause harm to somebody else is still the prudent and right thing to do.
That's right. And I hope everybody hears your message there, Mike, and will continue that even when they get the vaccine to continue taking those precautions. Now, one of the things that you're also involved in is your state plan for how we're going to deliver the vaccine. Is there anything that you can tell us about that or?
Well, it's interesting. I mean, given the fact that it looks like Pfizer is going to be the first one across
Mhm.
the line with, it's very very positive, looking for Moderna to be crossing the line not too far afterwards. These are going to require some interesting logistical considerations. With Pfizer's vaccine being required to be ultra cold frozen storage at minus 70 Celsius, that's minus 94 degrees Fahrenheit, there are limited places throughout our state, and I'm sure with most states,
Yeah.
where people have those ultra cold freezers and have that storage capability. We here in Iowa have 99 counties. We found 18 institutions throughout the state currently, at least through our assessment so far, that have ultra cold storage capability. And so, from a logistical perspective, getting vaccine out to the states and throughout the state, throughout most of the counties, we're certainly going to be relying on the cold chain storage and transportation of the company. Now, Pfizer has their own system, and so they've created what are basically described as soccer to football field sized freezer farms, one up in Michigan, and there's another one in Wisconsin, where these freezer farms have upwards of 300 or so of these ultra cold upright freezers to store the vaccine. And then they're going to be relying on UPS, FedEx, DHL, aircraft, and their transportation capabilities to actually move vaccine out on a daily basis to distribute it throughout the world. And so they've got a very interesting shipper that they've designed, which holds about 23 kilograms of dry ice pellets. And inside each one of these shippers, there are what can probably be best described as personal pan pizza boxes that are about 9 inches by 9 inches by 2 inches tall that'll hold about 195 vials of Pfizer's vaccine. Each vial is capable of delivering 5 doses. And so, about 950 doses per personal pan pizza box. And so they'll be able to put 5 of these pizza boxes in each of these specially designed shippers. And so that's how the vaccine will be moved in, basically just under 5,000 dose allotments from Pfizer's distribution center. And so that's how they'll arrive. And they're going to do a direct shipment to registered vaccine providers. And then once that arrives, they say the average transport time will be about 3 days. And so once it arrives, they say that their shippers, although can probably maintain that minus 70 degrees Celsius temperature for up to 10 days, as soon as it arrives at the destination, then they are recommending that either the vaccine is immediately used and distributed and given, or then you refresh the dry ice, and that would give you 3 to 4 to 5 more days of storage if you don't have ultra cold freezer capability.
Wow.
So taking all that into consideration, every county in our state and their local public health, working with their healthcare partners, are coming up with how they're going to deal with this. And so it's intricate and it's complex. But the good news is that once the vaccine is taken out of ultra cold freezing, each vial takes about 30 minutes to thaw at room temperature. Then if you refrigerate it, you get another 5 days at refrigerated temperatures. They say now that it will remain stable. So that gives us that opportunity to perhaps move vaccine without dry ice to places that could then hopefully, within a short period of time, administer the vaccine. Mm-hmm. Unfortunately, once it's reconstituted, there has to be some saline dilution done to the vial to bring it up to 5 doses. And so once the vaccine has been reconstituted or diluted, you have to use it within 6 hours. And so all of that is going to make the logistics and administration have to be very well marched out. People have to be trained to know what to do and how to do it safely so that we don't spoil vaccine.
Wow. Wow. You just made me think back to our H1N1 days when we were vaccinating people and those long lines and, the logistical craziness that went on with that as well.
Yeah, that's true. And that was a
This is going to be
refrigerator.
very interesting.
And so, every
Mm-hmm.
drop of vaccine that came into this institution came through me, emergency management, from public health. Well, that's not going to occur this time. Public health will, at least in my state, local public health will be allocated a certain number of doses from the state, and then they decide who these doses go to in their county. And
Mm-hmm.
so then the delivery will come directly to the end users, us. Although redistribution is possible, so they do have a mechanism to say, let's say we get a shipper full of almost 5,000 doses. We could potentially move some of that to somebody else over in the next county or whatever, with permission and tracking with public health's approval.
Yeah.
These shippers are all GPS monitored. They're pretty high tech. These shippers that are going to be coming have GPS capability as well as temperature tracking capability, so they will know that the vaccine is still viable and know exactly where it's at any given time during the shipping process.
Unbelievable. That's amazing.
Yeah.
Priorities, have
Mm.
you thought about those?
Well, we're waiting for the ACIP, I believe it's called, to make a determination on what the exact prioritization scheme will be
Mm-hmm.
definitively. I think that will occur after an emergency use authorization or approval from FDA comes out. But I mean, there's hints out there. If you look at the CDC playbook that's out and available to states and public health and healthcare entities, it's pretty clear that the intent with the first waves of vaccine that'll come out is to get frontline healthcare workers taken care of.
Mm-hmm.
Frontline healthcare workers, long-term care residents and workers. Obviously, they're a huge um, vulnerable population, obviously,
Right.
as well as emergency responders, first responders, emergency workers, and then critical infrastructure folks after that. So I think, that's the kind of prioritization that we can expect. And, that this is going to take some time. I think everybody's thinking, if things go well with the announcement that was done this week, there could be potentially an EUA applied for within the next week or maybe by Thanksgiving. And then depending on how long FDA takes to act on it and things like that,
Mm-hmm.
it could be probably first part of December where we might be getting started with all of this. And then with all the logistics, the initial doses going out, then you wait 21 days, get the second dose. And it's important to note, and this is critical, that this is a 2-dose series.
Yeah.
And the greater than 90% efficacy that was reported, which is, I mean, everybody's turning handsprings. If that bears out, that's more than we could ever have expected or wanted. We were hoping for 50, 60%. If it's really over 90% efficacy,
Yeah.
it's noted that is 7 days after dose 2. You get that greater than 90%. So one of the things we need to make sure we caution people is that you can't just go get one dose and be done with it. You have to get that second dose. And within about 7 days after that, that's when these higher efficacy numbers would be kicking in. So that's very important with people to know.
Yeah. And I'm just thinking here right now, we're going to be giving people their first doses and second doses pretty much all at the same time eventually.
Yeah.
It is,
And it's going to be really complex. I mean, there's
yeah.
going to be important tracking so that
Mm-hmm.
people and have reminders that, hey, your 21 days is coming up, go get your second dose. And then when Moderna or AstraZeneca or Johnson and Johnson or Novavax, as these other vaccines start
Mm-hmm.
coming onto the market, um, we're going to have to make sure that people understand that you can't mix vaccines. If you got Pfizer, you have to get Pfizer the second time. If you got Moderna the first time, you got to get Moderna the second time. So that's going to be an interesting logistical thing that we're going to have to make sure that people understand. And I know our state has put together a web page where we will have sites laid out all over the state where this vaccine is available, what type of vaccine is available, and so people can click on it and discover what and where they can get their vaccine. And then we have to make sure every person that gets vaccinated gets a little card or gets into a medical record, electronic record of some sort to
Mm-hmm.
make sure that they know what they got, when they got it, and when the next one is due.
Yeah. And I'm thinking as well for long-term care residents, they're not going to be able to come and get it. It's
Right.
going to have to be taken to them.
So
So
there's a
a lot of
partnership
work.
with local pharmacies and
Mm,
whatnot, that there's this pharmacy partnership with long-term care to make sure those folks are able to get their doses where they're at.
wow. Mike, this was so interesting. I think we could really talk all day on this, but I know it would be hard to get people to log into a call that lasts an entire day. But we really thank you. We thank you for one agreeing to talk to us about it, but definitely thank you for being one of the subjects and getting this vaccine and being part of that trial.
Well, and again, our thanks to you, the University of Nebraska Medical, and Emory, and everyone else who really laid the foundation for our ability to respond to this pandemic and to be able to safely care for people in the volumes we've been able to care for them with. I mean, your pioneering work is really a tribute to the devotion and professionalism that you all have really demonstrated to us, which is inspirational to us. And then my final message is to people in general. I mean, I know people are fearful of vaccines. There are people who absolutely don't want to do that. But I have to think that, contrary to what may be out there in social media and others,
Yeah.
this disease, as you well know, is devastating our society.
Hmm.
And if these vaccines, as they come online, are that effective and can make a difference in mitigating and flattening the curve and getting us back to some point where we're in a kind of a more normal way of life, people should accept this vaccine and they should get out and get it done, because it's not just for you, it's for you, your friends, your family, your loved ones. This is the right thing to do. And until that happens, which the majority of people, we're not probably going to be seeing them vaccinated until, late winter, early spring in any large numbers. We have to continue to do the right thing every day. Wear your mask,
Right.
social distance, wash your hands, do the right thing,
Even if you get the vaccine.
even if you get the vaccine,
Hmm.
and even if you've been positive in the past. Those
Right.
things cannot change.
Wow. Last thing, would you do it all over again if you had the chance?
Absolutely.
Yeah.
Absolutely. Yeah, I mean, it's the right thing to do.
Hmm.
And it's just, it, it's going to be for everyone's benefit. I was thinking of my family and loved ones. Everyone else, sure, I'd
Yeah.
absolutely do it again.
Well, thank you, Mike, and thank you again for talking with us. So for all the listeners out there, we hope you found something of value in today's conversation. We want to thank Mike for being our guest today, and I just can't tell you how much that is appreciated. So thank you. Thank you to the listeners for listening in. We would definitely love to hear from you, especially if you know someone that we should have a conversation with, or if there's a topic that you want to hear a conversation on. Additionally, if you have any questions, please send them to nbu@nebraskamed.com. And again, thank you for listening. Thanks again, Mike. Bye-bye.
My pleasure.